So next, which is our first panel discussion, I would like to introduce the panel titled "The COVID-19 Pandemic, Black People Fight Back." And it will be featuring Sister Lisa Davis, who will be speaking to us from Newark, New Jersey. As stated before, she is the vice chair of the coalition, as well as the chair of the healthcare working group. And she will also be joined by Dr. Aisha Fields, who is the director of the All African Peoples Development and Empowerment Project. She is speaking with us from Huntsville, Alabama. So I will introduce Sister Lisa first. Uhuru.
I need to be unmuted. Oh, Uhuru, again, comrades. And again, I'm very appreciative to be able to be here and talking about this very important topic that we know right now is currently just changing all of our lives, and that is the issue of health and how the United States, this country, politicizes it and weaponizes it. And many times, most of us, when we talk about the values institutions of this country, the police, the educational system, the justice system, the banking system, we all recognize the vicious institutions and history that they have in terms of racism and colonialism and how they have used that against us. But I have found that many times we don't think that way when it comes to the medical profession, and we really do need to begin to keep that truth in our minds. I'm going to break this discussion down, this talk down with myself into two sections. And if it doesn't seem as fluid as I would like it to normally seem, I apologize, but there are certain points that we must hit on. And Sister Eliki, again, just remind you to please give me a 10-minute warning, a 10-minute sign, because I want to definitely transition into the nuts and bolts about what we can do in terms of right now for our family members and ourselves. But just to give you a little bit about myself, very briefly, years ago, I discovered that nutrition was so important, it was essential to everything that we did in terms of eating a certain way and making sure that we were not eating certain foods and making sure that we were getting a very, very nutrient-dense diet. And when I learned that, I was able to give up aspirin, sinus medication. I used to have to take it every week. I have not had to take it in about 30 years. And I learned a very powerful lesson that we are what we eat. And that began my journey in terms of this very, very powerful journey in the field of health and also politics. And then at some point where as I saw that nutrition was very important, I would be introduced to another modality that would completely change my whole paradigm and my whole understanding of what health is and what health can be. And I would begin to look at things more in terms of systems. And if you have one certain system of health that says these are the rules and this is how you have to do things, which is like we have here in the United States, which completely removes nutrition from, the concept of getting better. It completely removes nutrition from that, and we have to get it back. But I recognize that there are other systems of health and knowledge in which the body absolutely can heal. So it was a paradigm shift for me, and it began of, again, my political struggle as well in terms of health, because I would then go into the hospitals and visit my comrades and apply the things that I knew. I would do that with my family. And I've been doing this for like the last 20 years, and I've amassed quite a library, my own personal library of books and health. So I say all of that to say that the things that I'm going to be talking to you about are things that I've lived and the things I have seen in these hospitals, because for the last 20 years, I've just been doing that on my own. I am not a doctor and I do not have a medical degree, but I have heart and love and care. And one of the things that we have to be reminded of, that we have to bring ourselves back to, is a very, very obvious truth, that somehow we don't know how this earth was created, regardless of what your religious background is or whatever. You might not believe or have any religion at all, but we do know this as a fact, that somehow this earth was created. And we do know this for a fact, that somehow life appeared on this earth. And we know this for a fact, that humans were not the first life forms on earth, and that the first humans on earth were probably not doctors, and certainly life came before the pharmaceutical industry did. And the key thing about that is that this earth sustained life. For thousands upon thousands of years, it sustained life. And that's very important for us to get back to and to just understand that relationship, especially when we are dealing with the colonialist form of health, which completely disassociates healing from anything to do with the earth or the beautiful, wonderful energies of this earth. Whereas African tradition, from what I'm understanding and learning about, did not do that. People sought to work synergistically with the natural elements of the earth, and they had great appreciation for these very obvious truths, whereas this colonized system of health does not have that. I want people to understand that when we think about health, that there is the disease, and then, there is the diagnosis, and then there is the disease. The diagnosis is an objective assessment of what is going on with our body. Our lungs might be filled with fluid. Maybe we have broken one of our bones. We might be congested. Our heart might be beating too rapidly. Our blood pressure numbers might be reading on a certain range that we don't, that's not really good for them to read. But these are objective assessments on what is happening with your body. But the disease is how we are socialized to dealing with these problems with our bodies, or, with health. The disease is how we are socialized to dealing with it. And it's very important that when we are talking about this pandemic and all the numbers that they are continuing to spew, and we always hear, the United States does have horrible numbers, but when we hear these numbers, and when we think about health in general, or sickness or disease, it's important for us to try to break things down as much as we can so we can get more of a picture of what is going on. It's important for us to do that if we have our own personal health battles. We think about we are here, and then we want to get to wellness, and sometimes the road or the field to get from here to wellness is very, very muddied and clouded for us. And if we learn to break things down, we can create a path. But it's really important that we do this with this pandemic. And I just want to show you some things right now that I've been tracking some of the numbers. They have, trackers that they track these numbers all over the world. And so I just started tracking these numbers as of March 24th. So I'm going to now try to bring up on the screen one of my trackers. Hold on one second, please. I'm going to share this with you. And let me just, okay, I don't see one of the ones that I wanted, but I can do it this way as well. Let me just try this a moment. Okay, here's one of the trackers right now. And if you look at this, you'll see the world, there's 1,732,000 cases of people who have contracted the virus, and that there are 106,347 deaths. But when we get to looking down at these numbers, and you'll see, it's broken down according to the US and China, and the countries that I have been tracking was primarily the US and China and some of Europe. But you'll see right here that the total numbers of death, we'll just go right here. The total numbers of deaths now for the United States is 19,666. But When we go to China, hopefully people can see this. I'll see if I can make this a little bit bigger on my screen. When we go to China, well, we see that the total number of cases people have been exposed to this in China is 81,953, but we see that the total numbers of deaths is 3,339. And there is a tremendous difference between 19,666 in the United States. In the United States, numbers have been going up in terms of deaths by like the thousands, whereas China's numbers have barely moved. And to just give you an example, when I first began to track this back on March 24th, the total number of deaths for the United States was 778, whereas the total numbers of deaths for China was like 3,281. So we can see that the United States numbers have increased dramatically, whereas China's has remained relatively the same, which indicates that they have, that they are containing this virus, that they have done quite a bit for their society, in terms of containing it and in terms of taking certain steps that the United States should be taking, but is not. And now they're trying to say that China is lying about their numbers, although when China was the primary country that was really faced with this pandemic and their numbers were climbing higher and higher, nobody was talking about China was lying then. But even if you just look for a moment at, some of the other countries, like they break this down also in terms of continents. So if you look at Asia, the continent of Asia, and we know that the pandemic hit in Asia. If we look at that, we see that the total number of deaths for all of Asia is 10,437. And that number sort of represents the trajectory for this pandemic as it played out in China. But when we look at Europe, the total numbers of deaths in Europe is 72,524. The total numbers of deaths in North America, with most of these deaths being in the United States, unfortunately, is 20,782. So that is telling us right there that there is something more that is going on than just this pandemic. There's something more that's going on than just that. And trying to just get my screen back.
Overall, Sister Lisa.
Yes?
You've reached 10 minutes of your
okay, thank
20
you.
minutes.
Well, I'm bringing this up because, now I see the thing to stop sharing the screen. I'm bringing this up because China definitely implemented certain things, and I'm not going to talk about what they did socially because that may have been very restrictive. We might not have agreed with that, but they did very, very deliberate things health-wise. And one of the things that they definitely did was they implemented nutrition. Every single time I read anything about China or any of the Asian countries and how they were combating this pandemic, they talked about nutrition. It is a matter of policy in China that they use their traditional Chinese medicines, traditional Chinese herbs. They have been using vitamin C. They've been working with countries all over the world, including Cuba. Cuba has an antiviral medication that has proven to be very effective. So China has done that, but the United States has not. Whenever we hear anything about the United States, the CDC, the World Health Organization, their basic message to us is avoid germs and basically die until we find a vaccine. So we clearly see right then and there that they are really promoting this corporate capitalist view of things so that they can create a vaccine that will create billions of dollars for some unknown company. But they are not emphasizing nutrition or health or anything. I think these numbers speak to that. And that's what we, in terms of our community, must do. We must definitely take a hold of this situation, and we can. We do not need permission, or we do not need their scientific bodies to validate some very key information that we have. Now I'm going to, now I'm going to try to share my screen again, because I want to get into some of the things that we can do. And Hopefully this file will come up. Okay, I don't see. Let me see if I do it this way. It's not. I'm just trying to, I put together actually I put it together. Oh, hold on a moment. You'll have to bear with me a minute because this is all new to me with working with this, but this is nutritional modalities that I had put together. So I'm trying to bring it up on my screen now, and I don't see the way to be able to do this, although I saw it before when I was, oh, hold on, I think I see it now. Hold on a moment. Is this showing? Can people see this on the screen? Is this, oh. Anyway, I'm just going to have to read from it, but I'm trying to get this to, let me just try this one more time. I apologize, dear people. Anyway, is this showing up on the screen? Is this presentation showing up that I have? Can you see it? Okay, anyway, I'm just going to start reading from this. I call this my Lisa's Nutritional Guerrilla Warfare Kick-Ass Home Remedies. I'm going to just go through some of these things, but basically my philosophy is if it causes no harm, to try it. Home remedies are something that we've been growing up with all of our lives. When our parents would cook meals for us, that's home remedies. They're using that nutrition to help to keep us alive. So if it causes no harm, I try it. And this is, this is how I'm going to prepare. I will never experiment with medication. I was reading about baking soda, and I was very, very surprised to hear that baking soda was something that they had used back during the pandemic of 1918 that kept a lot of people alive who used it. So baking soda is something that is very accessible. We can just take a teaspoon of baking soda. You should have it in your home. It causes no harm, virtually almost no harm. And we need to know about these things. We need to have playing in our heads that there are things we can do as opposed to there is nothing we can do and we have to wait for a vaccine. Another thing, steam therapy. Steam therapy is very, very useful. It's very helpful. It helps to open up your sinuses. No harm. There's no harm with this. I don't have to say that this is a cure or whatever, but this is a modality we should know about. This is something that we should have in our toolbox in terms of what we can do to fight this. I have right here some of the spices, what I call the spices of life that we can keep in our cabinets at all times, like cayenne pepper, ginger, turmeric, garlic, cinnamon, leeks, and various other kinds of herbs and spices that we should have, in our kitchens, in our cupboards. It's very, very important that we do this. Essential vitamins and supplements. I can tell you right now that vitamin C and vitamin D3 or vitamin D, they are lifesavers. I know of somebody in my family in her 80s, and she had pre-existing conditions, and she had been taking vitamin C and vitamin D just to be taking it like 1,000 milligrams a day. That's just what she made part of her lifestyle. And she discovered that she has COVID-19, and yet she is experiencing none of the symptoms. She's doing so well. You would not think she had it at all. You would maybe think she had the signs of a cold, and yet she's in her mid-80s, and she has pre-existing conditions, including being diagnosed with cancer 5 years ago, and she is doing very well. Liquid chlorophyll is an excellent supplement to have on hand. If you can't always do juices, liquid chlorophyll, you can just take like a capful of that and put it in your water. Cod liver oil is another great modality that we should have. Now, I'm going to also just talk a little bit about what you can do if you or your loved one has to go to a hospital. This is very important. They are saying that they have no treatment, no cure, but that does not mean that you have to silence your voice. Your voices should not be silent. We have to learn how to have different conversations with these doctors. We have to learn how to create a shift. You can and you should tell your doctor what you want, what you think should also be administered to your loved one or to yourself. And one of the things that should definitely always be administered whenever anybody is in a hospital is nutrition. And you can insist on nutritional therapy. You must bring it up to them. Bring up to them the studies on intravenous vitamin C therapy and vitamin C that hospitals are starting to do now. At least there's a hospital in New York, and I gave the name of this doctor, Dr. Andrew Weber of the Northwell Hospital. You can tell your doctors that you know about this what they are doing in New York, and that you would like vitamin C to be a part of its therapy. Also, we have right here, because one of the hospitals in China printed out their protocols where it shows that they are also using vitamin C, intravenous vitamin C. Bring this to your doctor or your healthcare provider. We do not have to go into them hospitals as if, we, without any concept of what we want to be done, of what we think should happen. Also, demand that the hospital does not talk to your loved one about signing a do not resuscitate order. I have been hearing that has been going on. We have a situation right now where a lot of the normal rules have been bent or disbanded. A lot of the normal rules in terms of hospitals, it's just been gone out the window. And we know we cannot get in to see them. And so we must make sure that we try to stay on top of this, because a lot of things have changed. And like I said, one of the things that I heard from one of the nurses that I know is that the doctors are talking to the patients about do not resuscitate orders. And that patient has nobody with them. No one from their family is there. So you want to make sure they understand, do not bring it up to them. And demand to know all the medications that are being given to your loved ones or to yourself. Try to do morning, afternoon, and evening checks. Demand that you want to know what is going on. They might have online systems where you can check those records. If they don't, this is something we must be working toward. And we also have to revisit that no visitors. We could do something, and we should be pushing for at least having one visitor assigned per patient and making sure that they have personal protection equipment. And then lastly, I want to say, and this is very critical, we have to, doctors, for the most part, do not monitor medications. They do not monitor the side effects. It has been my experience with so many people I visited in those hospitals, including my own family members, that they will give medications, the patient will begin to experience those side effects, and they will not look at the medications. We can no longer accept as normal that when somebody goes into the hospital or when they're under a doctor's care, that their condition gets worse. If you did not come into the hospital with certain symptoms, you should not be leaving the hospital with certain symptoms. Now, some very good tools that I have found that works very well.
Overall, Sister Lisa, we are at time.
Okay, I'm just gonna finish right here real quickly. I have right here the Physician's Desk Reference, a pocket guide. I think people should get that book and be prepared to carry it with you whenever you go visit a doctor or whenever you're in the hospital. And also, there are some additional websites, because you need to check just more than one source where you can look up side effects of medications. And I can assure you right now, if you approach a doctor with research in your hand, you are going to change that relationship with them. And that's what you do. When I haven't had the research before, they would just say all medications cause side effects. So I just wanted to make sure that you had this, and this is my guide, what I'm going to be doing and how I'm going to be fighting, and I will definitely share it with you. And I just wanted to, again, give you some definite things that you could think about doing today and implementing. And with that, I will now introduce, I have to remove this from the shared. Is this being seen on the screen?
Yes, this is still being seen
Yeah.
on the screen.
Oh, now I see it. Stop the share. Okay. I'm learning. I'm getting better. I'm impressed with myself that I found it so fast. I am now going to introduce a wonderful, wonderful, strong comrade who I am just enjoying so much getting to know better. And she is Dr. Aisha Fields, and she is the International Director of AAPDEP, the All African Peoples Development Empowerment Program. Dr. Aisha Fields is an applied optical physicist and International Director of the All African Peoples Development and Empowerment Program, a nonprofit development organization founded by the Uhuru Movement in 2007. As the director of AAPDEP, she is responsible for coordinating African community-led healthcare, agricultural, and educational programs on the continent of Africa and in African communities worldwide. Under her leadership, AAPDEP has built clean water systems, vocational and nursery schools, community farms, maternity centers, and a variety of youth and adult educational programs. Currently, Aisha serves as the chair of the COVID-19 Commission of the Uhuru Movement and is coordinating the development of medical teams in the US and Africa, along with on-the-ground and online outreach efforts aimed at providing the Black community with information and medical care during the time of this global pandemic. AAPDEP has led many programs in Sierra Leone, West Africa. AAPDEP medical personnel have trained hundreds of community health workers on the prevention, identification, and treatment of waterborne diseases and on the prevention of Ebola virus disease. AAPDEP has also worked with networks of midwives, nurses, traditional birth attendants to help to deliver more than 3,000 babies without death of mother or child. That is tremendous. Aisha helped to lead the charge to build Zenzali's Consignment, AAPDEP's nonprofit clothing consignment store and a fundraiser for its programs. Located in Huntsville, Alabama, Zenzali Consignment offers African-inspired and revolutionary clothing, accessories, home goods, natural personal care products, and more. A cultural and political hub for the African community, Zenzali offers a variety of community programs, skill-building workshops, and social events. And despite the grave conditions of existence faced by African people around the world, Aisha believes that sustainable development for Africa and African communities is possible, but only through self-reliance and self-determination. And she is the proud mother of 3 beautiful children, Sister Aisha Fields.
Uhuru.
Uhuru.
Uhuru. Uhuru, Sister Lisa. I just really want to express my most profound appreciation for the invitation to participate in this conference and for that tremendous overview that you just gave. I think it was really important way to start this conference and to start this discussion around COVID-19. I really want to salute your work as the Black is Back healthcare coordinator, and I want to salute all of the leaders in this Black is Back coalition. So as was stated, my name is Dr. Aisha Fields, and I'm the director of AAPDEP, which is an organization that was established by the African People's Socialist Party that leads the Uhuru movement. And we were established in 2007. And our responsibility within the Uhuru movement is to collectivize the skills African people have around the world in order to build concrete community-based development programs in the areas of agriculture, education, and healthcare. So now for more than 13 years, AAPDEP has been calling on and winning African people everywhere to take up the responsibility that we believe we have to the African nation. As members and volunteers with AAPDEP, we acknowledge that the skills that we possess do not belong to us as individuals. They belong to and have to be used for the masses of African people who, no matter where we find ourselves, whether we're in the United States, whether we're in Europe, whether we're in the Caribbean, South America, or in the continent of Africa itself, we live under the most horrible colonial conditions. And we recognize that African doctors, nurses, mental health workers, scientists, teachers, and other skilled people, we do have a role to play in the African liberation movement, and that role is for us to contribute our skills to not only building, concrete programs that will help to, in the short term, improve the quality of life of our people, but that we have a responsibility to be a part of the overall trajectory that African people have to be on to totally transform the conditions that have been posed on us, so that we recognize that there is ultimately political struggle that's necessary, and that the economic and social systems that right now dominate African people have to be overturned. So we take on our responsibility to, use our skills towards that end. And I really want to salute, my leadership, Chairman Omali Yeshitela, who is the chairman of the African People's Socialist Party, also serves as the chairman of the Black is Back Coalition, for his vision and his work towards, really building political and economic power in the hands of the African working class. And that has really been the strategic basis of the work for the African People's Socialist Party and the Uhuru movement for more than 50 years. And I really also want to salute Chairman Omali for establishing our party and movement's COVID-19 People's War Commission, which is our people's response to this global pandemic. So as the director of AAPDEP, I'm responsible for leading this commission, which has the following responsibilities. One, to identify and distribute best practices and other recommendations for the prevention of COVID-19. Two, to propose COVID-19 related internal Uhuru movement and community protocols. Three, use all available Uhuru movement platforms and others available to us, distribute information regarding the status of the coronavirus pandemic, any implications for the African community, and any efforts or information that will help the African community. Four, sum up the coronavirus pandemic politically and to help to implement strategies for continuing the anti-colonial struggle during this crisis. And finally, to build Project Black Ankh. So since the formal establishment of this commission on March 12, 2020, our organization and movement have been incredibly busy carrying out our work. Our medical advisory team has developed protocols, everything from how to minimize your risk while grocery shopping to how to care for yourself or a loved one who's diagnosed with COVID-19. Our outreach teams throughout the United States and Africa have been distributing informational posters, leaflets, and brochures, informing the African working class on best practices, personal and home hygiene, tips for boosting our immune systems, and how to prepare for and manage ourselves and our families during quarantine. Our social media pages and websites have been transformed into repositories for all things COVID-19, offering health information, resources for homeschooling, gardening tips, and financial resources for individuals and small businesses. Our journal, Burning Spear newspaper, has been publishing incredibly important political summations, allowing us to understand the coronavirus as a colonial virus, exposing this pandemic as only the most recent example of how African people and other oppressed peoples find ourselves utterly vulnerable and disproportionately affected by this other capitalist created disasters due to the lack of power over our own lives. This morning, I'd like to discuss AAPDEP's work to reignite Project Black Ankh, which is a program that we have built as the African nation's response to the Red Cross. Project Black Ankh was initiated by AAPDEP in 2014 as a response to the Ebola epidemic in West Africa. It was created out of a need to ensure that African people have our own independent capacity to respond to natural and imperialist imposed disasters that impact African people anywhere. At the time of the Ebola epidemic, we had a sizable AAPDEP organization on the ground in Sierra Leone, which is also where AAPDEP initiated our first development programs. Sierra Leone had been the location of many important AAPDEP programs, including some of the ones that Sister Lisa talked about. We had 2 maternity health centers, multi-acre vegetable and cassava farms, rainwater harvesting programs, vocational school, a nursery school, and a variety of youth and adult education programs. When Ebola hit, AAPDEP was not in a position to provide direct care for people infected with Ebola, but we did have the ability to make some other important interventions based on the skills that our AAPDEP members had, not only on the ground in Sierra Leone, but in other parts of the world. So Project Black Ankh Sierra Leone initiated a process that trained 50 community people to serve as community health workers, learning how to identify and prevent Ebola virus disease. We also connected with 40 Ebola survivors and their families, providing them with food, water, medicine, and sanitation supplies. You know, and as the Ebola survivors began to return home to their communities, there were real hurdles, you know, that they were faced with based on the fear that a lot of people had in the community around Ebola. So what we did to try to help address the stigma was for AAPDEP members to work with community entertainers who created skits and jingles that were performed throughout the community, holding up Ebola survivors as heroes, calling on the community to embrace them, you know, as such. Since that time, Project Black Ankh has intervened in Houston, African communities in Houston in response to Hurricane Harvey in 2017. But it's only now in the era of COVID-19 that AAPDEP has determined to build Project Black Ankh as a permanent program of AAPDEP as the African nation's response to the Red Cross. And as all of us know, you know, we all watched in horror as our brothers and sisters drowned in New Orleans. During Hurricane Katrina, we cried as we viewed the deaths and the destruction in the aftermath of the Haiti earthquakes. And we were scared and felt mostly helpless as we learned that colonial Ebola virus was ravaging West Africa. We felt a sense of sameness, though. African people everywhere, we felt that. And we all wanted to do something, but the only way that most of us had, we thought would be contributing to a way forward, was to donate to the Red Cross or to some other imperialist charity. We know now, though, that despite the billions of dollars we gave to help our brothers and sisters in Haiti, Red Cross squandered that money and built something like 3 houses. We saw the Clinton Foundation give relief money for Haiti to Chelsea Clinton for a wedding gift. And we saw organizations rescuing dogs and cats while African people drowned in New Orleans after Hurricane Katrina. And now during the COVID-19 pandemic, we see African people in the United States making up the majority of the deaths in this disease and are bracing ourselves for what may happen should this virus really take hold in Africa and the Caribbean. So all of this is what informs us that the time is now for African people to build our own independent capacity to take care of ourselves and our people. We are determined that now is the time to build and sustain Project Black Ankh. So as I said before, Black Ankh is being built as a humanitarian aid and disaster relief organization for the African nation. Our primary mission is to carry out relief operations, assist African victims of natural disasters and other emergencies anywhere they may occur in the African world. Our work focuses on disaster preparedness, disaster response, and community health. We're a volunteer program of AAPDEP that promotes self-reliance and self-determination for African people, and which practices African internationalist solidarity with the oppressed and colonized people of the world. We work, for a day where African people are free of daily insecurity and fear, where African people can receive care, resources, and hope, where we're ready and prepared for disasters, and where we have a community that's being trained constantly to deal with emergency situations that affect our people. I think it's really important to say that our work is not charity. This is not a charity model that we're taking on. This is the work of African people determined, to be self-reliant and self-determining. So, people can participate in our Project Black Ankh programs. One of the things that I want to, because I know time is winding down, one of the things that I want to talk about is our the 2 main programs that we have right now to address the issue of COVID-19. As I mentioned earlier, not only have we been establishing community protocols and establishing community outreach teams that have been working throughout the United States and Africa, distributing informational materials, postering. We've distributed hundreds, if not thousands, of posters and brochures throughout the United States and Africa. But now we're transitioning to focus on 2 really important aspects of our work. First is the establishment of a telehealth program. And so for those who may not be aware, telehealth is a practice of using technology to evaluate or diagnose and provide care for patients at a distance. So, so our telehealth program is really something that's going to offer African people who, as we said, are really being hardest hit with this COVID-19 access to medical support. So we have established a process where within the next month, we're going to be rolling out our telehealth program. We've been winning African doctors, nurses, nurse practitioners, mental health professionals, and other African healthcare workers to donate time to set up this online clinic, as of sorts. African people, not only in the United States, but wherever they may be, who have access to a telephone or who have access to the internet. If they have COVID-19 related questions, maybe they're at home caring for a loved one who has COVID-19. Maybe they themselves have COVID-19, or maybe there may be some kind of medical situation that happens in their home that they might normally see their doctor for, or go to urgent care, or go to the emergency room, but because the hospitals are overrun, with COVID-19 patients, the whole system is essentially being prepared for collapse. They don't have access, to our, normal avenues for healthcare. So our helpline will not only, our telehealth program will not only address issues related to COVID-19, but if there's some other situation that you need medical support for, you can access our nurses, doctors, and other healthcare professionals through our telehealth program to help with that. We're really excited about that and really grateful for the support and unity that African healthcare workers have given to this project. And we really want to say that this is open to African people everywhere. So not only are African doctors and nurses from the United States, Africa, the Caribbean, Cuba, wherever African healthcare professionals and others who are willing to work under the guidelines of this project, wherever you are, you can plug into this process. Also, it's available again for Africans anywhere to access. So you don't have to be in the United States. Wherever you are, if you can have a telephone or access to the internet, you can have access to this telehealth program, which we're working on rolling out within the next month. Another really important program that we're involved in right now is our community brigade program. We know that there are lots of vulnerable people in our community, and not only are we having to deal with the question of the health implications of COVID-19, but we're having to deal with the implications of various levels of quarantine, and our people, many of our people don't have the ability to shop for 3 or 4 weeks worth of groceries, don't have the resources for that. Or even if you do, you may go to your store and the things that you need are not there, the things you need for fever reduction or the vitamin C or all of the things that, we would need to continue to keep our immune systems up, to feed our.
We can't hear you.
Oh, okay. You hear me now?
Yes.
Okay, sorry about that. So our community brigade is a process where our outreach teams are transitioning now and being the front line to identify in the communities where we're working who are the vulnerable in our community, who are the people, who are the elders that can't get to the grocery store, who are the people who might have special needs that don't have the ability to get their medicines, who are the people that might have extra rice, who are the people that might have extra of something else that could be distributed, where are the needs, where are the people who need those things, and connecting our community and being people who make the runs to make sure that people get what they need, who are heading to the store. We're working with essential workers who might have the ability to travel back and forth for some official reason, who can be a part of this process, where others may not have the ability to do that. So our on the ground forces are leading the charge around that. The same people who've been putting out the hundreds and thousands of posters and leaflets are spearheading that, but other people can join this process. They can join a community brigade that might already exist in a community where we've been working. If people want to start one in their own community, then they can, contact us by sending an email at info@developmentforafrica.org, letting us know that they want to be able to participate in the community brigade. You don't have to be a healthcare worker. You don't have to have any specialized skills. You just have to be someone who wants to ensure the safety and protection of our community. So we also want to just call on African healthcare workers who may be participating in this webinar, who may see it later, people who might know of African healthcare workers, again, and others who are willing to work under the guidelines of our program, to go to our website, developmentforafrica.org. You can, on the very front page, there's a place there where you can click if you want to join our COVID-19 healthcare team. we are, we're very, seriously making the call for people to participate that. I know my time is running out, but before I go, I wanted just to say something very quickly as reminders for us. We know that right now, we're in a critical time in the United States. Over the next few weeks, they're really expecting a tremendous spike in the number of cases of COVID-19 and deaths. And we already saw yesterday that United States, I think, was over 2,000 deaths in one day. This was over the projections that they had indicated. They thought they were going to be much, maybe 100,000 less than, how many actually did die yesterday. So we're calling on African people. Don't wait on anybody, your governor, your mayor, anybody to tell you what you need to do. We need to be understanding that we need to be staying close to home right now the next few weeks. Don't go anywhere, including the grocery store or pharmacy, unless it's absolutely necessary. Coronavirus spreads through the air and it lives on surfaces. People can be carriers of the virus and don't know it and can still spread it. Try to maintain at least 10 feet. I know we've been hearing 6 feet. Let's try to maintain at least 10 feet distance from other people when we're out in public. If you have to go to work or if you have to go out for any reason, wear a mask or a bandana and glasses to cover your eyes. Wash your hands often with soap for at least 20 seconds, especially before you touch eyes, nose, and mouth. If you're out somewhere and you can't wash your hands, carry or use a hand sanitizer, has at least 60% alcohol. Frequently disinfect surfaces at your job, in your car, or on your bicycle. Stay healthy. Follow those tips that Sister Lisa talked about. Work on boosting your immune system. Eat healthy foods. Drink plenty of water. Get adequate rest. Get exercise in non-contact sports like walking, biking, or calisthenics. If you're experiencing any of the following symptoms: fever of 100 degrees 0.3 or higher, a persistent dry cough, loss of taste or smell, or fatigue, self-isolate. That would mean manage your symptoms at home. Don't go outside in public for any reason unless it's absolutely necessary. And if you live with others, make sure you limit your interaction with them and limit your time in common household spaces. Use separate utensils for eating. Use a separate bathroom if that's possible, and pay special attention to cleaning any surfaces you may touch or use in common with others. A full protocol can be found on our website, again, which is developmentforafrica.org. If you experience any of the following emergency symptoms of COVID-19, please seek medical attention immediately. If you have difficulty breathing or persistent pain in your chest, if you have bluish lips or face, if you start experiencing confusion, this is not an exhaustive list. So please seek medical attention if you experience any symptom that you feel is severe, even if it's not on that list. So also, again, I want to invite everybody to visit our website, again, developmentforafrica.org, get helpful tips and protocols for resources for homeschooling, growing food, and for links to economic resources that may be available to you. I really want to appreciate the opportunity to participate in this webinar. I want to say that we will get through this, African people, but we know we're going to get through it because we're creating for ourselves the structures, the protocols, the organization, the mechanisms for us to get through it. That's how we know we're going to get through it. So let's continue to do what we can. That's protect and defend the African community, the African nation at all costs. Thank you again for the opportunity to present.
Uhuru. Uhuru.